For Biden's COVID plan, they eliminated cost barriers for prevention of healthcare. This means whether you're insured or uninsured, you won't have to pay for COVID testing, treatment, or the vaccine. Biden has also offered federal assistance to hard-hit families by implementing a health crisis unemployment initiative to help workers with loss of work due to COVID. He also supplied unemployment benefits to those who lost their jobs but couldn't meet the criteria for unemployment due to the pandemic.
There is a state and local emergency fund which provides interest-free loans to small businesses, as well as mortgage and rental relief for workers who were impacted by the coronavirus. And because there is no information in the Constitution about this situation, it is the state's responsibility. There are very inconsistent COVID laws differing from each state because the states have the flexibility of creating their own laws. And because of that, it is difficult to keep the virus in check. For example, Michigan declared an outbreak of COVID-19 even before Iowa stated a mask mandate.
Travel restrictions are necessary to reduce the spread of the coronavirus. A lot of the spread is due to traveling across borders. Recently, last Monday, President Joe Biden reinstated the COVID-19 travel restrictions on non-U.S. citizens who have been in Brazil, Ireland, the United Kingdom, and much of Europe. He also extended the restrictions to travelers who have recently been to South Africa. As you can tell on the map to the right, there are no areas of green. Green represents where travel restrictions have been lifted. So as you can see, every area of the globe has some sort of travel restriction. Even though in the U.S. the states would have control over its citizens' health and safety, the federal government has decided to take the leading role in how to handle the run of this pandemic. Who has the power? The federal level or at the state level? According to the Constitution, the states have the power over their citizens' health and safety. That is something the federal government doesn't have control over, but the states do. However, the severity of the pandemic has caused the federal government to take control of this issue. This is due to, in each state, if they have their own regulations, it will not be able to affect people traveling from one state to another. The borders aren't going to stop people from spreading the disease. Only the federal government will have the power to unify all the regulations and implement them all on everyone nationally. According to whitehouse.gov, the national emergency caused by the COVID-19 outbreak in the United States continues to pose a grave threat to our health and safety. I included this to support the fact that the White House does acknowledge that COVID-19 poses a threat to the health and safety. However, the federal government still must take action in order to help stop the spread. They also stated that it is the policy of my administration to implement science-based public health measures across all areas of the federal government to prevent further spread of the disease. Biden's plan is to work based off science-based knowledge rather than political.
We can connect all of this to class and what we learned in the lecture and our Zoom meetings. We learned that federalism is a political system in which national and regional systems of government share power and are considered independent equals. Some advantages of federalism that we learned in the lecture are also shown through the laws regarding the coronavirus. Federalism allows flexibility among state laws, which is clearly happening because each state has implemented their own course of action regarding COVID-19. Federalism also allows for experimentation. The states have been experimenting with the laws that they put into place because this is such a fresh and new situation.